patient was receiving the correct amount of stimulation throughout the study. Moving down here, we see evaluator and a subject undergoing transcranial magnetic stimulation. And what the evaluator here is holding is a coil. The patient is wearing on her head a tracker device that is also on the coil. And it allows us to have a co-registration between the patient and this computer software system that we see up here, which is a BrainSight 2 from Rogue Research in Canada. That allows us to place a virtual grid over the patient's head that corresponds to the EEG 1020 system. And so what we can do then, as the evaluator, I can move the coil from spot to spot on the patient's head, and we have monitoring electrodes placed on our target muscle, which in this computer screen we see the motor evoked potentials, MEPs, which is essentially a muscle response that is elicited by the transcranial magnetic stimulation. So the way this works is I'm holding the coil, and it makes a big tap, tap on the patient's head, and we will see a response in the target muscle. So depending on where I'm placing the coil, we'll see a response in the corresponding muscles. What we're interested in there is going from spot to spot to see what parts of the brain give us responses in our target muscles. With the stroke patients, and especially in the severely affected ones, on the ipsilesional side, we didn't see many maps at all, which is common for that population. However, we mapped the contralesional side as well to see how changes affect in neuroplasticity. Does the contralesional side change, and how does that correlate to behavioral measures? That was something we were interested in. So this is a TMS. This was what we performed at baseline and post. So let's see what we found out in our results. The preliminary results of the Fuglemeyer Assessment Scale, which is what I'm going to talk about next. The Fuglemeyer, for those of you who aren't familiar, it's kind of a therapist will ask the patient to do a ranging of motion. They'll move the arm of the patient. They'll ask, does this hurt? Does this not hurt? Can you do these different kinds of motions? And the ability of the patient to perform those tasks is an indicator of progress. So what we're interested in here, this first is an illustration that all of the different groups, and each group here, this is the below intensity before training, the above intensity during training, or before training, I'm sorry. So the first two are before, below and above. The middle two are during training, below and above, and then the last group is sham. And that will stay consistent throughout all three groups. So the first column will correspond all the way down. The top graph is a baseline measure, so how did all of the groups compare at baseline? What we see here is in the muscles that we trained using the Fuglemeyer motor score, all of the groups, considering only the elbow and the shoulder, because that's what was trained during the robotic movements over here, they were comparable across the board. As we look at the changes, so what the Fuglemeyer measures, we're looking for an absolute change, and these are averages for each group, I'm sorry. And the N in each of these groups is about N of 5, 5, 5, and 4. And an important thing to note is this is an ongoing study. Power analysis is that we need a total N of 60, and right now we currently have 24 patients. So we're about halfway there. Keeping that in mind, as we move to our motor changes, what we see here is that the group that received PNS at the low intensity, while they were on the robotic arm device, made the most motor improvements. As compared to sham, all of the groups improved in their Fuglemeyer motor score, and again, these are averages with standard error bars for each group. The group that improved the most was the below during training. And again, when we only consider the Fuglemeyer on the joints trained, again, the shoulder and the elbow, we see a similar trend here again, where the group that received the stimulation at a low intensity, while on the robot, showed the most improvements. How does that compare with our findings in the transcranial magnetic stimulation, or the neuronal reorganization? It's important to note here, what we want to look at are changes in map volume. So the x-axis, I'm going to walk over here to the side of the presentation for a second. On the baseline here, this is the grid that we overlaid again in the virtual TMS, the virtual grid using TMS. And the z-axis is the volume, how big of a response did we get at that particular spot. And so I went from spot to spot to spot, and the vertical axis is how big of a response we got. And what we're interested in is volume changes from pre to post. So what I have here is these two graphs are of one patient that was in the before group. So each graph here is one patient per group. We picked one representative that corresponded best with the changes that we saw over here. So a person who changed a lot here, or we saw a change that these two correlated the best that we could. So we see every group, every person's map volume changed contralesionally, which indicates that neuronal plasticity is in fact occurring in this chronic, severely affected population, whereas previously that may have not been as well understood. So we see the greatest changes occurring in the above before group, which is right here, and the below during group right here. It's also important to note that in the above before group right here, we see the establishment of a new spot ipsilationally that was not present at baseline. So that speaks for itself, you know, that this person had a stroke years ago and all of a sudden a new spot could arrive that wasn't present at baseline through this intervention. So in conclusion, what I want everyone to take away from is that peripheral nerve stimulation, when paired with intensive task training, can in fact help this population where previously a lot of clinicians or the understanding of this population has not shown as much promise. So a patient can come in years after stroke and their brain can still change and they can continue to show improvements here. So future studies involving this technology would be to pair this nerve stimulation, and again with TMS, with conventional occupational therapy, and then as well identifying how feasible or practical is it to apply peripheral nerve stimulation in the clinical setting. So thank you all very much for your time.